Awesome. Thank you. So hi, everyone. Welcome to our Academic Health Department webinar. This is going to be pretty informal. We have never really tried anything like this before, but we wanted to invite you all here to just kind of put us on the spot and ask whatever you would like to know about Academic Health Department partnerships. So we do have a few slides just at the beginning to kind of, for anyone who's new to the concept, to just lay some groundwork, but then we're planning to just open the floor and we'd love to hear what you have to say and what you want to talk about. So I'm going to pull up the slides right now with any luck. Just give me 2 seconds. I'll share my screen. And hopefully you all can see the slides now. So yes, welcome again. Welcome to our webinar, Ask Me Anything, Academic Health Department Partnerships. We're really excited to be talking with you this afternoon about Academic Health Department partnerships. And as I just mentioned, we've never done anything quite like this before. So we really are looking forward to engaging in this discussion with all of you. As we get started, just wanted to run through a handful of housekeeping items. So you probably noticed when you came into the webinar that all participants are currently muted. We do ask that you keep yourself on mute just as we go through our brief presentation to help reduce any background noise for others, but we hope that at some point you will come off of mute and you will engage in an open discussion with us about AHD partnerships. At any time during the event today, please feel free to use the chat box to ask questions, to share comments, to talk about things you're working on, share your experiences. Once we go through these handful of slides, we will open the floor for discussion. At that point, feel free to raise your hand, to unmute yourself, and just dive right in if you would like to ask questions out loud or share what's going on. If you do have any technical difficulties, as we're in the webinar today, please also send us a message in the chat box and we can help work with you to troubleshoot that. The slides for this meeting are available, and I think Jennifer will throw those in the chat box so you can have a copy if you want to download and save them for later. There are a handful of links in the slides, so that just is the best way. That copy is the easiest way to access those as well. And as you just saw, we are recording today, so just a heads up on that. And we will be posting this archive publicly available online and sharing with others in the learning community and outside who weren't able to make it today. So with that, we just wanted to start off with some quick introductions. My name is Kathleen Amos, for those of you I don't know yet, and I'm the Director of Academic Practice Linkages at the Public Health Foundation. As part of my role here at PHF, I work closely with the Council on Linkages between academia and public health practice on all of its initiatives, including the Academic Health Department Learning Community. And I've been doing this work for just over a dozen years now. I am joined today by the chair of the Council on Linkages and the chair of the AHD Learning Community, Dr. Bill Keck, who I will invite to introduce himself to you all as well.
Hi, good afternoon, everyone. As Kathleen mentioned, I'm Bill Keck, former Director of Health for the City of Akron and Professor Emeritus at the Northeastern Medical University, Northeastern Ohio Medical University. During my career, I've led 2 academic health departments, one for 27 years, one for 2.5 to 3 years. I've also, of course, been on the academic side. So hopefully that experience will be helpful to us today.
Awesome. Thank you so much, Bill. And you will probably see and hear a few other colleagues that are joining us today. Ron Bialik, who is the president and CEO of the Public Health Foundation. He's waving for those of you who can see him. Who will be helping us manage all the questions, hanging out in the chat box. So if you want to talk to Ron, that's where you can find him. And then we have a couple of members of our team that works with the Trained Learning Network, Jennifer Harmon and Samantha Draper, who are helping with all the technology. So if you have any trouble with anything related to being in the webinar, feel free to let them know and they can help you with that. We'd also just like to introduce you to the Council on Linkages between academia and public health practice for anyone who's not really familiar with that group, the Council on Linkages is a consensus-driven collaborative of national organizations engaged in public health, and it works on initiatives that are designed to benefit the workforce broadly. So the Council on Linkages has been around for about 30 years now. It has 24 member organizations currently, and it really works to improve the performance of individuals and organizations within public health by fostering collaboration, promoting ongoing education and training, and strengthening public health infrastructure. Members of the Council on Linkages, as you can see on the slide here, span a variety of professional groups within public health, as well as federal agencies, the accrediting bodies for both health departments as well as academic public health, and the certifying body for public health professionals. And the Public Health Foundation, or PHF, where I work, serves as the convener of the Council on Linkages and provides the staff support for all of its activities. Nope, I seem to, oh, here we go. Sorry, wrong button. So one long-standing initiative of the Council on Linkages is to provide support for academic health department partnerships, or AHD partnerships, as we often refer to them. And that's what we're here to talk about today. So as I mentioned, we're going to start with just kind of a brief introduction to these AHD partnerships and to the Council on Linkages AHD Learning Community, and then we will open the floor to you and your questions. We will do our best to answer whatever questions you send our way, as many as we possibly can in the time that we have today. We're happy to follow up if we don't get to everything today. And we also really welcome your expertise as well. There's a lot of knowledge in our virtual room here, and so we do hope that you will jump in with your own experiences and share with others anything that might help them succeed in this work as well. So before we dive right into doing that, we'd also love to just learn a little bit about you. So we do have one quick poll. We're curious about what type of organization you're joining us from. And so we invite you to share that in the poll that should be on your screen now. If you do have any difficulty with the poll, feel free to drop your answer in the chat. Or if your answer is other, feel free to share more about that in the chat as well. So we'll give people, I can see everyone filling it in right now. So we'll give people just a few more seconds on that. Awesome. Oh, this is exciting. Great. Wish y'all could watch it in real time. Samantha, if you want to close that poll and share the results, that'd be perfect.
After I launched it, it's telling me that the polling session is inactive and I can't see the button to close it.
Well, let's see if I can do it. It looks like I can do it.
Sorry.
No, you're good. I don't know why that would happen, but so hopefully y'all can see the poll results. Looks like about 60% of those who are here today are from local health departments. So that's a fantastic turnout on the part of local health departments. Way to go. I think Ron mentioned several earlier. And about a quarter of the people in the room are from academic institutions, and then a number from state health departments, nonprofits, and federal government as well, and just a couple others. So here we go. Thank you. That's always really informative to us, and I hope kind of set some context as well as you're talking through academic health department partnerships and what everyone is working on. So as I mentioned, we'll start off with just a brief overview of what an AHD partnership is and how those might be useful. And I wanted to start just with a quick definition. So throughout the webinar today, we'll be talking about partnerships that have been built between health departments and academic institutions, or academic health department partnerships. These partnerships can take a variety of forms, but at their core, they're collaborative, mutually beneficial relationships that serve to strengthen and formalize collaboration. So really this idea of moving the relationship between the organizations beyond kind of working together once in a while because two people know each other, happen to like each other, to making it more of a sort of a regular part of how the organizations operate. These partnerships can help enhance public health education and training, research and service, strengthening the current capacity and workforce of the organizations involved, as well as building for the future. AHD partnerships can look quite different from one community to the next, as I'm sure you'll hear more about as we go through the session today. There's no kind of right way to do this work. But with that said, there are some kind of basic characteristics that the Council on Linkages talks about as being part of an AHD partnership. So at the most foundational level, as you might imagine, an AHD partnership has at least one academic institution and one health department working together. And as part of working together, there may be some type of written agreement linking the organization. So this could be a contract, it could be a memorandum of agreement, a memorandum of understanding, or something like that. And then through the partnership, the organizations may engage collaboratively in providing education and training to students, as well as the current workforce. They might work together on joint research projects or jointly provide public health services. These partnerships can also involve sharing personnel, funding, or other types of resources between the organizations. So we wanted to take a quick pulse check. We'll see if we can get the poll to work here. I don't know, Samantha, if you're able to do that, or I can try if you can't, but we're curious a little bit about getting a sense of your experience with AHD partnerships. So no, Samantha, do you have that or no?
It's still giving me that same note that I'm logged in from another device and my polling session is inactive.
That's strange.
I've never seen that before. I'm sorry.
Me neither, but no worries. We've got it up on the screen now, so we will go from there. Thank you, Jennifer, for taking care of that. But yes, we're just curious about your experience with AHD partnerships. And again, if the poll's not working for you, please feel free to drop a note in the chat. And so we will give people a minute or so to weigh in. We have a good mix at the moment between people who have lots of experience and people who are working on it. Excellent. A few more seconds. Perfect. So I am going to end that poll and I will share the results with all of you. So hopefully you can see that now. It looks like about half the people who are here don't have AHD partnerships in place yet, but are working on it. And then we have another, well, it's going to make me do math, about 40% of people who have AHD partnerships in place. So hopefully all of you will share the experience that you have with those partnerships with everyone else in the room. And then we all know what's an AHD partnership again. We will be talking more about that.
Mm-hmm.
Awesome. So it is great to see how many people are involved in AHD partnerships. We do know that collaboration and partnerships between academic and practice organizations are widespread. And we know this because both the National Association of County and City Health Officials and the Association of State and Territorial Health Officials collect data on partnerships through their profile studies. These data show that the majority of local and state health departments work with academic institutions in some way. So about 88% of local health departments work with colleges or universities, with 62% having regular meetings, written agreements, or sharing personnel or resources. So some of those things that we tend to associate with having a more formal partnership. Similarly, 100% of state health departments work on projects with academic institutions. These AHD partnerships can really strengthen the connections between public health practice and academia, enhance the capacity of the organizations involved, and really help to further those pathways into governmental public health. There are a lot of reasons, a wide variety of reasons that organizations might choose to engage in these partnerships. And some of what we've put on the slide here to highlight are just some of the more common ones that we hear about. So AHD partnerships can help the organizations really enhance their capacity and better address community health needs. Many of these types of partnerships involve student training through things like internships or practicum experiences, or having the health department staff provide guest lectures or giving them adjunct appointments in academic programs. And these experiences can really help provide students with more practice-based content, practice-based perspective, which can help better prepare them for jobs in health departments when they graduate. AHD partnerships can help with the recruitment of qualified personnel, particularly again in terms of having those pathways between academia and governmental public health. They can help facilitate lifelong learning, both for practitioners as well as faculty members. They can help with the development and use of research that is relevant to practice. So a lot of these partnerships bring academic researchers closer to public health practice. They tend to emphasize more community-based research activities. Help to maximize the use of limited resources by working together and combining, as well as enhance the organization's competitiveness for new resources. Help in meeting accreditation standards, both for health departments as well as academic institutions. And as you can see, kind of thinking of all of these collectively, they're really all part of a larger picture, which serves to help improve the public health system as well as community health. So I wanted to just say a couple of words about the AHD Learning Community for anyone who is not engaged in that group yet. So the Learning Community is an initiative of the Council on Linkages that aims to help support organizations working to develop and sustain AHD partnerships. So really to provide an opportunity for people to explore the idea of AHD partnerships and to learn from each other. The Learning Community has been around now since 2011. It's open to anyone who's interested in participating, and currently has more than 1,200 members from health departments, academic institutions, and other organizations across the country. The Learning Community offers a way for people to connect with each other, with others who are engaged in this work, as well as resources and tools, training, and technical assistance to organizations working to establish and grow AHD partnerships. So some of the activities of the Learning Community include things like sharing stories and highlighting AHD partnerships. We have webinars often featuring AHD partnerships, developing resources such as we have a collection of agreements that organizations have used to formalize their partnerships, and enabling dialogue and assistance. And all of these resources are freely available to anyone who would like to use them, whether they're a member of the Learning Community or not. So with that, I'm going to stop talking for a minute. I do want to stop the presentation here because really what we're here for is to hear from all of you. So we would really love to talk about whatever you would like to know related to AHD partnerships. So please feel free to send your questions our way. You can do that through the chat feature, obviously, or also feel free to raise your hand to come off mute and jump right into the discussion. We don't know everything, but we will do our best to answer as much as we can, and also encourage you if there's something that you have to share related to the topic that we're talking about, please do jump in and share that as well, because as I mentioned, we have a lot of expertise, I think, in the room, and so it'll be really great to hear what everyone is working on and what everyone is doing. So I'm actually going to stop sharing my screen at this point so that we can all see each other. As I mentioned earlier, feel free to have your cameras on, whatever is comfortable for you. We have tasked Ron with corralling questions, so I'm going to kick it over to him to see where we should start.
Great, thank you, Kathleen. So there were questions submitted in advance, so we have those in front of us as well, and I'm looking in the chat, and so I'm going to ask a multi-part question that addresses a number of the questions I'm seeing. So Bill and Kathleen, how do you initially fund an academic health department? And then how do you sustain the funding as well as sustain the engagement and the partnership itself? Any suggestions?
Well, it's a key question and there isn't a good answer. We haven't found any major source of funding for this work. We do know that a number of groups have been able to find funding in their own community to help support them. But mostly what's happened is that folks have found ways to rearrange their own budgets somewhat creatively, and perhaps in a combined way with a partner, to make it possible to hire someone, for example, to manage the whole process. So what we've seen agencies do is split a position so that they'll hire someone who's paid partly by the health department and partly by an academic institution, as someone who works in both places, knows the culture of both places, who can pull it together. That's one of the more common things. Some folks have managed to bring a department and an academic institution together to do a project or two and secure external funding for that helps support personnel involved. So it's just really being creative. I don't know, Kathleen, have you run into other kinds of examples?
I think that about sums it up. From what we've heard from, health departments and universities all across the country, I'm not sure there is any sort of national level funding that supports this type of work at the moment. A few organizations that I've heard that have gotten like dedicated funding to really build their AHD partnership has been mostly like state-based kind of philanthropic foundations. Although I don't know, there is a whole bunch of money going out the door related to infrastructure and workforce development over the next little while. So I don't know if there'll be any opportunities there. But I think a lot of it has been, as Bill said, more piecemeal, kind of like a little bit here, a little bit there, grant funding that they've been, you've been able to like have part of a person paid for through this grant, and you'll work on this project together and sort of piecing it together a little bit here and there. That I think also brings, up, as Ron mentioned, the sustainability question, because it does become sort of an ongoing, I don't know if challenge is the right word, but an ongoing endeavor to continue to support that type of thing. I think there are organizations who have started out with some of the piecemeal kind of pulling a little bit of leftover funding here, some extra grant funding there to patch it together. And then over time, that position that helps to coordinate the partnership has become sort of more ingrained and more just like part of the operational support for the organization as a whole. And, whether that's paid for out of indirect costs or how that works, it's going to depend on the organization, but to be able to essentially prove its worth and how important it is to the operations of the organization.
That's really a key point, I think, particularly with larger health departments. If you can find a way to build this into your budget over time so that you have control of it and it doesn't rely on someone externally making a continuing decision to support you, you're much better off. And so the split positions often are a way to start doing that.
And I see Antonia put a note in the chat box, and definitely feel free if others, if you have thoughts about funding or how you've done it, to share in the chat box or to, raise your hand, unmute yourself, that kind of thing. But Antonia put a note in the chat box about funding an AHD manager through the CC Public Health Infrastructure Grant. So there is $4 billion about to go out through two state health departments and through state health departments from CDC to really work on infrastructure and workforce development. And so there's a lot of flexibility, to my knowledge, with that funding. So there may be some opportunities to think about how that can be used to support some of this stuff. And Tanya, dive right in.
Yeah, I was having some technical difficulties. I had to leave and come back. Yeah, so we're very excited that our academic health department really took off, especially during the pandemic, with the establishment of our support for local public health. We're a decentralized state in Massachusetts. So we were able to use part of our, I believe it was our lab capacity funding, to initially support a vendor to actually take on our academic public health corps. And you can go to mass.gov if you want to check out all the organizations that are involved. And there's a recorded webinar from I'm blanking on time, January,
February.
5 years ago.
1,000 years ago.
Yeah, where I dived in to talk about the partnership. So we started out as just doing this free together, and then we're able to get some funding to have it managed by an organization. So it is supporting 13 because we're so lucky. We have 8 schools and programs of public health, and then a few more that are coming online with MPHs that we're partnering with 13 academic institutions and growing. From a sustainability standpoint, it's so funny that came up today because last year at this time, I was setting up a trust fund for the academic health department. And I have my appeal that I'm going to be sending out to our academic partners and also to those that we want to invite to join so they can see a little bit about what it's about and what their financial support can mean. So we did this during the pandemic when we had zero money for this. And for 2 years in a row, I got an average of about, and this doesn't sound like a lot, $18,000. But that actually enabled us to provide funding for some of our interns who were part of our academic public health corps. So I have grant writing as well as annual appeals in my past. And so those sorts of things continue to be helpful.
I love that example. And the grant writing piece too, I think cannot be underestimated. We kind of alluded to this in sort of walking through some of the benefits of AHD partnerships, but I think there's a lot of opportunity. And obviously you have to have specific things that you want to work on together, but to use that kind of mechanism to acquire funding, we've talked with health departments and small rural health departments who've been able to get millions of dollars of additional funding by partnering with the university and working together to write those grants that then become projects that they work on together. Others that have really focused on using some of the university expertise in terms of evaluation component for some of their activities and been able to apply successfully for grants to move that work forward. So I think that doesn't solve all the problems, but it is one avenue that may be available depending on where you are and what you're working on.
You know, it means just be creative and work with your partners to think about ways that you might not think about by yourself. Yeah.
Absolutely.
You know, I'm seeing, and Tanya's still here on my screen. I'm going to ask this question that came in advance. And of course, Kathleen and Bill, you may have responses to this as well. But are there any experiences with volunteerism within AHDs? You know, categorizing people as volunteers, having volunteer activities, carrying out projects, etc. And I know in your experience, and Tanya, you've had that.
Yes, definitely. So there are a couple ways people can go with that. One is if your state has the Medical Reserve Corps, we ended up establishing a separate little box that people could check during the pandemic if they wanted to volunteer specifically around COVID-19. So that was one way that we were able to get volunteers. That is a cumbersome process as a person who piloted it myself, because I don't like to have others do what I haven't tried doing myself. And you know, you have to they have to do a query and that kind of formalized background check. And so it can be problematic for some. In working with an academic institution, some of them may do that for their students anyway. So it's important if you're working with an academic partner to ask if they do that sort of verification. And then the other way is, you know, just literally using Google Forms and spreadsheets to put out opportunities that we need folks to support with a specific project description, and people sign up and you talk to them and you interview them and you match them, and you evaluate how it went. So there are many different ways that you can engage volunteers. AmeriCorps is another way. Until last week, we were really set on applying for our public health AmeriCorps opportunity. And while I'm sad that as a state, we're not moving forward with it, we are going to be looking at other partners to perhaps lead and be a partner and collaborator as they do an application. But just, we had one too many roadblocks. I'm a pretty optimistic person, as you can probably tell. And even I hit dead ends that are insurmountable. So, but the AmeriCorps provides for public health, the deadline for that grant is January the 1st. And so there is time. It's not actually very difficult to write because it's a 10-page document. The hardest thing is wrapping your head around what it is that you need to do from a design standpoint and having the evidence as in a peer-reviewed journal article to support your intervention. So Kathleen, if people want to reach out to you and try to connect with me on that, I'd love to share any insight, because I'd love to see some public health entity have an AmeriCorps program. We have a great model that I'm happy to share, but we just can't afford all of the pieces at this time. So, but it's a good option if folks have a little bit of infrastructure to support that.
Thank you. And because, let's see, Carrie from Washington State mentioned about experiences with their partnership and sharing information about that. And several people have chimed in saying, yeah, here's my email address. Can we get more information? So I'm going to do two things. One, Carrie, if you'd like to speak with us now and convey some of your experiences, that would be great. Alternatively, oh, Carrie, you said you're happy to? Okay, go forth.
Sure. Hello, all. I am in Seattle, and I am with the Washington State Department of Health, and I am in a relatively new office for Washington DOH, the Office of Strategic Partnerships. It's an office that reports directly up to the Secretary of Health, Dr. Shaw, and our office includes partnerships for academic partnerships. So I'll speak to that in the higher ed world, but just for context, what else is in the Office of Strategic Partnerships? There's folks who do K-12 partnerships with the K-12 community across the state. There's our tribal liaison and our tribal partnerships lead are also housed in the Office of Strategic Partnerships. And our local health jurisdiction partnerships, so coordination and partnership with the local health departments across the state, as well as public-private partnerships. So sort of strategic partnerships broadly across public, academic, K-12, tribal, and local health. So my role specifically, I love my role, and I came from the academic community into DOH. So I work with institutions of higher ed across the state, both at the community and technical college to the public and private four-year institutions on workforce development front. So engaging with academic partners related to degree programs, certificate programs, other things related to public health and or healthcare workforce. So thinking about healthcare workforce, public health workforce, engaging with students around internships, practicum, capstone. So all things related to students, recent graduates, workforce development, and also supporting research partnerships. So when academic institutions reach out, they'll reach out to me and they'll say, we have a research grant. We would really love data from the Department of Health, or work with some of the Department of Health epidemiologists on climate change and air quality related to wildfire smoke in Washington State. Who can I chat with? So I can be the bridge between the academic partners and the subject matter experts at Washington DOH to help connect them. So I sort of think of myself as a bridge builder and a partnership builder. I'm a connector, I'm a facilitator. And then I step back when the subject matter experts at Washington DOH and those in our academic partner world are connected. I can bow out, but I can also step back in if there are any challenges related to contracts, MOUs, memorandums of understanding, anything where I can sort of, again, just help facilitate and make it easier. But I think for those who are in agencies where such a role might make sense in your agencies, it's really fantastic, I think, for academic partners to have like a place to go, because before they would say, Washington DOH employs thousands of people, who do I go to? Well, they know they can reach out to me and I can help bridge them. And I think the other piece is in the workforce development space, our academic partners a lot of them are doing some similar amazing work across the state, but don't always know it or don't know where DOH may be supplying the same data to different academic institutions for different work. So helping to support those connecting points and doing some convening and supporting collaboration has, I think, helped some of our academic partners to be more successful in just knowing what else is happening in the state, where they might be able to complement their work and their research and their student engagement. So I'll pause, but that's the nature of my work. The other piece I would say that's been really helpful during the COVID era was I worked in partnership with leaders across our academic institutions around COVID guidance and around monkeypox guidance to make sure that the guidance that Washington State DOH was issuing from our subject matter experts who are working in that space was responsive to the feedback that our higher ed partners were sharing they were needing. So just being a bridge also between sort of the subject matter experts and the academic partners. So I'll pause there. Happy to field any questions, or also happy for folks to reach out.
Mhm.
Thank you. I think those are some excellent points. And what you just said about the like having the person, I don't think you can underestimate that. Like we hear a lot that, you know, the health department or the university is like some gigantic sort of nameless, faceless institution. And how do you even approach knowing who to talk to if you want to work together? And so having that person that you know you can go to that then will connect you with other people, I think becomes really valuable. Whether that's like a shared position where you have someone who spends like part of their time in the health department and part of their time at the university and kind of knows the players and who's involved, or whether there's like a person in either organization that can, the two of them can work together and build those connections. I think we see it happen in different ways, but I think that's a really critical piece that can't be under. The value of that, I think, is humongous in terms of just like having it feel more approachable, or like knowing that you have someone that you can talk to if you have an idea, or you have no idea who might know something about it.
Great. I want to thank people who've been putting things in the chat box, of providing, resources, links, suggestions. Thank you so much, because again, as a learning community, that's what it's all about, is sharing and learning with and from one another. So I have a question for you guys, Bill and Kathleen, or frankly, for anybody else who wants to chime in. Part of this question has sort of been touched on, but I'm going to ask it anyway, because it's the second part that's really not been touched on. What are the benefits to a health department of an academic partnership? And how do you measure impact? How do you evaluate this? Any thoughts?
Well, Kathleen did include a slide at the beginning that listed some of the benefits that we've learned about over time with the learning community. But I can go through some, maybe add a few more. So the first thing is, usually these partnerships begin with students. That is, the academic program or institution needs a place for student practica to occur, and that's often the first contact with the academic institution, reaching out to a local community agency, often a health department. And with that, of course, come students. There are both advantages and disadvantages to having students in a health department. But the real advantages, I think, are, first, there's nothing that tends to keep you on your toes and more current than having a student around asking questions. So it's a way to help your staff be sure that they're confident in their professionalism. And of course, students, many students who come to health departments don't end up working there. They work someplace else. But the more they go to that place with having had the experience in the health department, which at least in my experience, has helped the health department gain some credence within a community, having a lot of people around working in different areas who have some understanding what the health department is and what it does. Of course, if you're tied to an academic institution, then you have access to the skills that exist in that institution. So I always enjoyed having my own personal epidemiologist I could call to help me out with the latest report, that says coffee causes cancer. Well, I know I'm going to get a call from the newspaper or the radio station pretty soon to ask to follow up on that. So having somebody I could call to check my response with was helpful, just as an example. It's also an opportunity to do some workforce training in your own institution. And if your agents, if you're going to partner with an academic institution, part of the environmental scan you should do ahead of time is to figure out what kind of training might benefit the people who work for you, and to see if the skills exist in the academic institution you're going to partner with that can help you do that. Kathleen's, I think, mentioned the hiring advantages that come with that. You have students working for you. It doesn't take long to get a sense of which students you'd like to have as an employee and which you might not. And so when positions open, having that experience can often lead you to a high quality employee. It's an opportunity with that linkage to find answers to questions you might have in your own agency, or the little research projects you want to know, how to improve attendance at a maternal and child health clinic, for example. Something like that, small projects that might, or with questions whose answers might help you deliver services a little bit better. You've heard about finding new money in these relationships. That's important. What we haven't talked about is that sometimes when you're linked, particularly if it's a formal linkage, it gives you access to the resources that exist at the academic institution. Libraries, the meeting facilities, the IT equipment, and so on. Generally, for many health departments, having access to that bumps their capacity up substantially. Let's see, we talked about the FAB accreditation, and what else? Oh, you know what we haven't mentioned, which is really part of this, is improving evidence-based practice. We hear a lot of talk in the research community about the importance of practice being evidence-based. Well, to have evidence-based practice, then you need sort of evidence-based research. And if you have access to experts in particular areas, it may help you really improve the kinds of programs and services you deliver. And we've said we hope all of this improves community health. We can't prove it yet. It's one of the real research questions we hope researchers will begin to help us answer. This all seems like it would improve services, and we have some at least functional and procedural evidence that it does, but I don't know that we have any real solid claims to improved health status, for example, in a community based yet on these interrelationships. So maybe some of you can help us get that kind of evidence. Well, that's a starter.
I think that, oh, sorry, Ron, did you want to say something?
Nope, go ahead, Kathleen.
I was gonna say, I think that leaves me with the evaluation part of the question, which is, you know, kind of challenging maybe. So I think that in terms of evaluating, I think I'm not sure I've seen a lot of evaluation period, but of what I've seen, it often tends to be the quantitative things, like how many, so Bill was talking about internship programs and having students. And so I've seen groups kind of quantify the increase in their internship programs as a part of having these partnerships. Like, you know, pre-AHD partnership, we had 5 students a year, and now we have 50 or 100 or whatever. Also quantifying like additional grant funding or resources they've been able to acquire through partnering together. The University of Tennessee and Paul Irwin, when he was there, developed a logic model for evaluating AHD partnerships, and that is published. I was Googling while Bill was talking. I found the link for that, so I'll drop it in the chat. It's in the Journal of Public Health Management and Practice, so it's unfortunately not freely available, but if you have access to that journal, that could be interesting if you're interested in looking more at the evaluation. Paul Irwin and Ross Brunson and their kind of evidence-based practice research efforts have also started looking at whether, as Bill was kind of just alluding to, there's not a lot of research on the impact of AHD partnerships, but they have started looking at the impact of AHD partnerships related to evidence-based practice and things like that. So I'll drop a couple of articles in the chat if anyone is interested in learning more about that. I've also seen groups just build out, in addition to having kind of your general partnership agreement, building out a work plan. So like maybe a yearly work plan of what do we want to accomplish together this year? And so then to be able to measure and kind of track that progress over time. So I was
Kathleen, I see a hand up.
Yeah, Zena has her hand up.
A brave soul. Thank you, Zena.
Well, hello, everyone. As you are aware, at Public Health Foundation, we are well on our way to formalizing many of our academic health department agreements. But one of the benefits that was not mentioned that we're actively putting into our agreements is the ability to influence curriculum, and not just for traditional public health positions that we often think about, like nurses and EPIs and such like that, but also working with the data science program to include some pieces of what, because they're traditionally tasked with building dashboards and whatnot, but really partnering them with intern experiences, but parts of that curriculum actually working with our epidemiologists to marry both pieces of that, and hopefully generate some interest in data science in our health department as well.
Ron and Kathleen, I think maybe I'll take a risk here and let people know that the three of us are working on a book about academic health department partnerships that really is based on the experience we've gained in our own personal professional lives, plus our work with the learning community. It is almost finished. We're hoping that within the next month or two, we'll be able to get it edited and published sometime in 2023. So we'll perhaps ask you to look for that, but much of what you're hearing today is part of that book. It's not long, it's only 11 chapters, but it contains information. I tend to think of it as sort of a how-to manual for partnerships. And so look for that.
And we'll be sure to send it out to the learning community once it's available as well.
Yeah.
So I have a gazillion questions, but I'll ask this one because this takes several again and puts it together. So a number of folks have asked about expanding the partnership beyond a single health department and a single academic institution. Multiple health departments, multiple academic institutions. What about community-based organizations? What about hospitals, et cetera? Any thoughts about that, of how you make that happen? Is it advisable? Should one stay away from it, et cetera?
Well, it really depends on your environment, doesn't it? There are lots of examples of this, by the way. There are certainly health departments that are linked with multiple academic institutions, and the reverse is true. I think part of it really depends on what you want to accomplish and what benefits there are for your health department or your academic institution. And we're not talking, of course, about just schools and programs of public health, but many of the other academic institutions that support public health. You should really do your environmental scan. That is, see what academic institutions are available to you, what strengths and weaknesses they have, what problems or issues that you're dealing with they might be able to be helpful for, and think hard about it. It does get complicated if there are more, so you need good communication. And actually, we think one of the more important things to do is to be sure to have a champion in each institution you work with, someone who hopefully is high enough up in the hierarchy that they can make decisions and make things happen. But someone who is not that high up can be a good champion if they have a boss who is responsive and in league with what it is you're trying to accomplish. So if you have someone on the inside who helps you find your way, who helps get things through the various bureaucracies involved, you're much better off and much more likely to have something go on. And if you want to maintain these, you really should start off, I think, by looking for a win-win situation. If you're good, make your early projects that are likely to fruition, so that it provides a positive feedback loop, if you will, in order to keep going with this. But certainly, if you have the capacity to do it, and if it's of significant benefit, you should go ahead. All these partnerships require a lot of hard work. They are not always easy. Matter of fact, often they're not easy. And so you really need to assess your own capacity as a partner, as a collaborator. You need to be sure that you personally are the right person for the job, or that your agency has the resources it needs to carry this out. But if you're careful about lining your ducks up before you get together, then certainly multiple partnerships can really be helpful.
I think this is when we saw the question coming into the webinar, because this is one that several people had shared in advance as well. This is where I thought, and Tanya, because the Massachusetts, I think, is a great example of really building out a consortium model. Their AHD, they have an academic health department consortium that involves the state health department, and then I don't know what you're up to now, 11 or something universities and colleges to come together as a group and work together, as opposed to, you know, sort of like 100 one-to-one relationships.
Yeah, and I think this is also starting to, well, it's not starting 2 years ago. It started to benefit local public health. So in addition to it being more formalized at the state level, it's also been able to help support our 351 local public health entities, which is really important. And I did put something in the chat about from an evaluation standpoint, like an academic partner has the opportunity to seek funding for that, and having the opportunity to be able to pay graduate students to do data analysis, data entry, like all of that is really helpful too. So the other thing that's been really helpful regionally is to work really closely with the Public Health Training Institute and trying to bring some trainings regionally to expand the knowledge of those who are interested in local public health, who are already in local public health, perhaps without like sanitarian credentialing or other credentialing. Mm-hmm. We also just had our credentialing move from one part of state government into our State Department of Public Health, where it should rightfully sit. So excited for that too. And continuing education is a requirement for that. So see lots of opportunities to collaborate with our academic partners for them.
Yeah, I just wanted to, Kathleen or Ron, add one other thing here. The question was, what about other community agencies besides health departments? Ron, Kathleen, and I have argued this back and forth many times. The health departments, of course, are not the only agencies that would benefit from an academic connection. And in my own experience, we've been able to link in Planned Parenthoods, substance abuse agencies, mental health agencies, child health and support agencies. There are a variety of organizations, agencies that can benefit under the right circumstances with an academic connection. So we even in the book suggest that while the title focuses on health departments, the reality is other agencies can apply the same principles and benefit in many of the same ways. So just if you're from an agency that is not a local health department, don't let that stop you. if there is some value in an academic connection. And I should add, with the advent now of bachelor's degrees in public health and the continuous expansion of schools and programs of public health, community sites for practicum experiences for students are increasingly competitive and at a premium. And so while the first thought might be a local public health agency is the place to go, certainly valid experiences can be had in a number of other community settings. And so that may be an opportunity to connect with an academic institution very directly.
Great. So we only have a couple of minutes left, and I'm going to throw this last question out. My apologies for not getting to everybody's questions. Rex, you'll end up getting back at me at some point. But let me throw this one out, and if there's time, we could get to Rex. So maybe Bill and Kathleen, you could be quick. What's the most important advice for an institution looking to establish a relationship with the other one? So in this specific question of the local health department with a university, but I could look at it both ways. So what advice do you have?
Ooh, think carefully before you leap. Try to understand the culture of the other organization a little bit, understand what drives them, because they're quite different in their approach, quite different in how they report and what's expected of the individuals working in them. And then do that environmental scan. Think carefully about who you are, where you are, what you need, and what the other agency or institution has and can bring to the table to help you. And then if you decide that this is something you want to do, find a champion. Find someone you can work with so you know who to call. Someone who will be helpful and supportive in the other agency. That's a quick answer. There's more, but that's a quick one.
Yeah, this could be a really long one.
Yeah.
Very short answer, communicate early and often, I guess. You know, that I don't think you can underestimate the importance of communication and trying to pull all these pieces together, and just having that open channel of communication, I think goes a really long way to making all of this function.
Yeah, and I should mention that knowing Bill for years, we can really understand how he was successful in establishing and maintaining and expanding academic health departments, because honesty, trust, humility, all of that is really, really key. And Bill has that in addition to lots of expertise and lots of talent. So I think that's key for people to think about. Rex, we've got 1 minute.
So I go back 30 years when I first met you, Ron, where our SACHO in Maryland of the local health officers knew that we needed to develop better relationships with the School of Public Health there. And we ended up contracting with you to help support us on multiple things. And so, yeah, you never know how these partnerships will grow and develop and how they'll affect our careers as we move forward. So I encourage folks to think about it and move into this. And now we have a SACHO in Missouri that's moving forward to becoming a public health institute, which has an academic base in regards to the staffing and faculty. So yeah, I think there's a lot of opportunities there. And you are very skillful, Ron, at taking part of my question and working it into some other things. So thank you.
Ron, you're on mute if you're trying to talk.
I'm sorry. Typing in the chat and doing I was going to turn it back to you guys. Thank you very much, Rex.
I just want to thank you all. I know we're a little bit over time, so I won't go back to the slides, but if you grabbed a copy of the slides, and those are available on our website, and we'll send them out afterwards as well. There are a handful of resources in those slides as well, including contact information if you'd like to get in touch with us, learn any more about this. We did have a quick closing poll. I don't know, Jennifer, if you can bring it up real quick before everyone leaves. But we were just curious, and you can do the poll or you can just let us know in the chat or send me an email. We were just kind of curious of like, did you enjoy this? Should we do this again? We've never done this kind of thing before. I definitely had fun, but just because I had fun isn't a reason to do it. So we're just interested in some quick feedback of whether it was worth it, basically.
Yeah, and
So-
Kathleen, I've saved the chat. So we have the questions that came in beforehand. So those are things that potentially we could follow up with.
Yeah, so this was fantastic. I didn't get to read the whole chat the whole way through, but I'm really looking forward to that. And like we said, we're happy to follow up. I'm sure there are 1,000 questions we did not answer. Our poll is at 94% yes, so maybe we'll try to do this again sometime. This was a lot of fun. We really thank all of you for participating today, for coming and sharing what you're working on, what you're thinking about. Always fun for us to engage. And yes, someone just asked about a recording. There will be a recording available. We'll need to process that, just make sure the audio worked and all that kind of stuff, but we'll send that out to all of you as soon as we can get that done. We are headed to the APHA annual meeting next week, so a little bit crunched for time right at the moment, but we'll make sure you all get a copy of that as well as the slides, the chat, all of those pieces. So thank you so much. And feel free to continue to put questions in the chat and we will follow up. And thank you, Bill. Thank you, Ron. Thank you, Jennifer and Samantha.
All right. And there are the results of the poll.
So no no's. So
Interesting.
awesome.
All right.
Thank you all.
All right. Thank you.